Hi, Lindsay, Stephanie, and Dr. James. Happy Saturday. Gosh, as far as what's going on with me right now, the coronavirus craziness is, something that will go down in history for sure. Since I work in a hospital, I'm still going to work regularly. And not too much has changed for me. Unfortunately, since the gyms are closed, I typically spend about 7 to 10 hours a week in the gym. So not being able to go there and kind of have the camaraderie of my gym mates has definitely been difficult. But I do have a little gym at my house in the back patio, so that has been helpful. My husband's been able to work from home, which has been great because I know that he can be safe here. And just being able to spend more time at home with the animals and with him has been nice. So I work in Palm Beach Gardens, Florida at a hospital there. So we're definitely starting to see cases increase. And let me tell you, the mental stress of like, oh, you have a cough, oh, I have a sniffle, like, is this it? That stress is something that definitely has kind of gone unaccounted for. So I'll tell you, on my days off, I literally just try to rest as much as possible because you are just completely emotionally and mentally drained by the end of the day. So the topic that I decided to choose was in the chapter about African American health issues. So I had been shadowing a nurse practitioner that worked in infectious disease, which I am hoping to pursue in physician assistant school once I finish my bachelor's. And we were constantly across the board seeing African Americans with diabetes being a huge health issue in African Americans. But not only did they have diabetes, they were coming in with infections in their hand and feet that could only be resolved by complete amputations. And this was something we were seeing regularly across the board. And she is also an African American nurse practitioner. And so I was asking her, like, why is it that people are waiting until the very last minute, until they have to go to the emergency room to completely have amputations or lose their vision or their hearing from diabetes to get help? Why are they waiting to go to the ER? And so, she wasn't really sure, but it's something that she also saw regularly. And so from reading this chapter and the PowerPoint that Dr. James provided on African American health issues, there was a little tidbit or a slide about the Tuskegee experiment, which we know was African Americans who had syphilis or were in latent stages of syphilis or even didn't have it. They were in this experiment and, they were not getting treated with penicillin, even though it was known to cure syphilis. So kind of what that proved to me, and it was like my aha moment, is that the distrust in the government and the physicians really started back then and has trickled down through generations into 2020. So even though African Americans are only getting treated in the ER once they are having these health issues that they cannot resolve, they aren't going to the physicians or going to the doctors regularly because of this fear of the government treating them poorly from this experiment that happened all these years ago. So they may not be aware that that's the reason they aren't going to the doctor, but it really has trickled down from generation to generation in this generational fear of physicians and them not getting the proper treatment. But then it just seems ironic that they wait until they're so sick they have to go to the hospital and then be treated by a physician. So it kind of is like a catch-22, but it was just eye-opening to me that, like, okay, maybe that's why they're waiting so long for that treatment, is because they just have this huge mistrust in the medical field. So this obviously just goes to show that there is just, a huge disconnect between the government and African Americans and how they've been treated poorly in the past and how, they just feel like they can't have trust in that societal part of the world and working in healthcare. So this topic definitely will help me influence with people, because when I am giving care to patients, once I am a physician's assistant, I can kind of take a step back and say, hey, I understand that you may be fearful from things that you have heard or maybe generational fears of not being treated properly, but my job is to treat you, make sure you're treated properly, and give you longevity with good quality of life. So when I see patients who are coming in that are maybe so sick, I kind of will think, well, maybe there's a reason that they waited until they were this sick to come see the doctor. So as health education specialists or as physician assistants, treating minorities or giving advice or health advice to minorities, it's definitely something that we have to consider, is the history behind our position as medical professionals and their position as being a minority, and maybe the mistrust and fears that they have in physicians. So at a personal level, if I'm going to the grocery store, for instance, and I see an African-American person that may be making really poor health choices, or choose a lot of unhealthy foods, I might have to think to myself, well, maybe they just haven't been in the position or haven't been educated well enough to make right decisions to really increase their quality of life. So that was the aha moment for me. It's been really fun getting to know you guys this semester, and I just wish you guys all the best. Please take care of yourselves, be safe, and yeah, best of luck to everybody. Bye.